Everything you need to know about Levitra and vardenafil. Vardenafil is an erectile dysfunction medication. It's recommended for men over 50 or those who suffer from hypertension or diabetes. It's available in 3 different dosages: 5, 10, and 20 milligrams. One pill should be taken 25 to 60 minutes before intercourse. It's effective for up to 4 to 5 hours. What's the difference between Levitra and vardenafil? Levitra and vardenafil are the same medication and they work in exactly the same way. Originally, the medication was sold under the brand name Levitra as the pharmaceutical company Bayer held the patent. However, in 2018, the patent expired and other pharmaceutical corporations began to manufacture medications with the same active ingredient. These are referred to as generic medications. They are cheaper, clinically approved versions of the branded medication with identical effects. How does Levitra work? Some people think that vardenafil causes involuntary and continuous erections. Don't worry, this is not how the medication works. The medication increases blood flow to the penis, which helps you achieve and maintain an erection. However, this only happens with sexual stimulation. After ejaculation, or when you are no longer aroused, the blood flows out of the penis and the erection ends.